Welcome to Clinical Tools Library, evidence-based scales and questionnaires designed to support healthcare professionals in practice. The Autism Diagnostic Interview revised assesses developmental history and behavior related to autism spectrum disorder. It focuses on communication skills, social interaction, and repetitive behaviors. The main purpose is to aid clinicians in diagnosing autism spectrum disorder in children and adults. The interview collects standardized information from caregivers to identify symptom patterns consistent with diagnostic criteria. It supports differential diagnosis by distinguishing autism from other developmental or psychiatric conditions. The tool enhances diagnostic accuracy through structured evaluation of core autism symptoms. The Autism Diagnostic Interview Revised is indicated primarily for children and adults suspected of having autism spectrum disorder or related pervasive developmental disorders. It is most useful in clinical settings where a comprehensive, standardized caregiver interview is required to obtain detailed developmental history and symptomatology. This tool is particularly effective for patients with sufficient language skills to allow for retrospective reporting, typically those aged 2 years and older. It aids in differential diagnosis by systematically assessing social interaction, communication, and repetitive behaviors. Its use complements observational assessments and is valuable in multidisciplinary diagnostic evaluations and research settings. The Autism Diagnostic Interview Revised consists of 93 items organized into 3 main domains: reciprocal social interaction, communication and language, and restricted and repetitive behaviors and interests. The questions are semi-structured and require the interviewer to obtain detailed developmental history from a caregiver. Each item uses a categorical response format ranging from 0 to 3, with 0 indicating absence of abnormality and higher scores reflecting greater symptom severity. The interviewer follows a standardized script to ensure consistency and probes for specific examples to clarify responses. Once completed, scores are summed across domains and compared against established threshold cutoffs. For instance, a score of 10 or higher in the reciprocal social interaction domain suggests significant impairment consistent with autism spectrum disorder. Communication scores above 8 in verbal individuals and 5 in nonverbal individuals also indicate concern. Restricted and repetitive behaviors require a minimum score of 3 to meet criteria. Scores below these reference values generally do not support a diagnosis, but must be considered alongside clinical judgment and other assessment instruments. The Autism Diagnostic Interview Revised demonstrates a sensitivity ranging from approximately 0.8 to 0.95 in identifying individuals with autism spectrum disorder. Sensitivity refers to the tool's ability to correctly detect those who truly have the condition, meaning a high sensitivity reduces the chance of false negative results. Specificity of the instrument typically falls between 0.7 and 0.9. Indicating its capacity to correctly identify individuals who do not have autism spectrum disorder, thereby minimizing false positive outcomes. For example, a sensitivity of 0.9 implies that 90% of individuals with autism spectrum disorder will be accurately identified by the interview, while a specificity of 0.8 suggests that 80% of individuals without the disorder will be correctly classified as not having it. These metrics support the Autism Diagnostic Interview Revised as a reliable instrument in clinical diagnostics when used alongside other assessment measures. The Autism Diagnostic Interview Revised was developed in the early 1990s by Michael Rutter, Anne LeCouture, and Catherine Lord as an expanded and standardized version of the original Autism Diagnostic Interview created in the 1980s. Its validation process involved extensive field trials and collaboration across multiple clinical sites, aiming to enhance reliability and diagnostic accuracy for autism spectrum disorders. Research conducted by Lord and colleagues demonstrated high inter-rater reliability, with coefficients often exceeding 0.9, indicating consistent scoring between different evaluators. Concurrent validity was supported through strong correlations with other established diagnostic instruments such as the Autism Diagnostic Observation Schedule, with correlation coefficients typically above 0.85. The test's sensitivity and specificity were assessed in large clinical samples, often surpassing 85%, reflecting its effectiveness in correctly identifying cases of autism and distinguishing them from other developmental disorders. Subsequent studies across diverse populations, including various age groups and cultural backgrounds, have reinforced the instrument's robustness and cross-cultural applicability. The Autism Diagnostic Interview Revised remains widely cited in the literature as a gold standard tool, supported by substantial empirical evidence attesting to its psychometric properties. Thank you for watching. For complete information and official PDF resources, visit clinicaltoolslibrary.com or check the link in the description below. And don't forget to like and subscribe for more clinical insights.